Now, we've been talking a lot about the new strain of COVID on the programme today. Matt Hancock told us earlier that Dr Susan Hopkins of Public Health England is probably the leading expert in the country on this new strain. So it's very convenient that we can now speak to her to find out more. Thank you so much for being on the programme this morning. So when was this new strain first discovered and what alerted you to it?
So new variants are found all of the time, and in particular in this strain, this was identified initially from a patient in September, but the whole genome sequencing was returned in October. Even then, there was nothing to particularly highlight that this was something of major concern, as variants come and go. In late November, we were trying to understand why Kent and Medway were not reducing with the national restrictions. And we performed detailed clinical, behavioural and epidemiological investigations, including whole genome sequencing, and found that there was a cluster that was rapidly spreading across Kent and Medway that was this variant, which we then called a variant of interest. And we tried to understand where else it had spread and could see it was also spreading into London and also Essex. We notified the government last Friday week and did further work with academic partners looking at modelling and understanding the virus compared to other variants that are circulating, of which there are many, and found that this week that with all the evidence stacking up, that this variant was much more transmissible than the other variants in circulation. And that made us hugely concerned and notified government on Friday.
You notified the government on Friday, but surely the Prime Minister must have known before that, though. You must have been keeping the government informed.
So absolutely, we were talking to the government on a daily basis. The results of the modelling on transmissibility were all summarised and presented on Friday morning to the new and emerging respiratory virus threats advisory group by a number of different groups around the country doing modelling and phylogenetic evidence of the virus. So that was the first time that all of the evidence came together, where the nerve tag group felt that they could confidently say with moderate confidence that this had higher transmissibility than the other viruses that were circulating.
I know, of course, you're a scientist, not a politician, but just listening to the timeline, the fact that you were keeping everyone informed on a daily basis, why was the Prime Minister still insisting it would be inhuman to cancel Christmas on Wednesday?
We did not have the modelling evidence to show that the transmissibility was increased or that the R value is increased on Wednesday.
OK. So you're saying there about you knew that it was spreading to London, to South East and the east of England. Is there any evidence that this variant has spread to other parts of the country as well?
So yes, we have evidence that there's virus in other parts of the country, but in very small amounts. We've got two methods that we're able to detect this. So first of all, whole genome sequencing. Whole genome sequencing takes 2 to 3 weeks to return results so that we can analyse them because it's a highly complicated process. We know that from the whole genome sequencing, there is small amounts in other parts, but about 1 in 20 of the laboratory confirmed cases have whole genome sequencing. So when we detect it, we know there's definitely some there and likely to have some spread. We then look at the data from the Office of National Statistics Coronavirus Infection Survey, where we monitor the types of genes that are detected. And in this case, this variant is not detected by one of the laboratory tests using the S gene. And so we're able to monitor that across the whole country. And what we can see is that the amount of the S gene that we can't detect has remained stable in the rest of the country, but has increased very dramatically from middle November in Kent and Medway, and from the end of November, beginning of December in London and east of England. We're not seeing that anywhere else in the country. And part of the reasons that we were increasingly confident that it was more transmissible is that areas that we're seeing rapidly rising transmission were also areas where this variant was becoming the dominant virus. And that's where we start putting all of the evidence together. To confirm this, we'll need laboratory studies, and those will take some weeks.
Reassuring to hear that it's only really increasing, as you say, in these specific parts of the country. But where else have you detected it?
So as I said, it's been detected in many other parts of the country. Every region has cases, but with very small numbers. It's also been detected in Wales, in Scotland. We've not yet detected in Northern Ireland, but whole genome sequencing has not been performed on very many specimens. In other parts of the world, the similar strains have been detected in Denmark, Australia, and there are other variants that look very similar to this that have been detected in South Africa, in the Netherlands, and other countries. We're not yet confirmed that these are the exact same as this variant, because this variant has a very clear genetic makeup that we can follow.
OK. The Prime Minister said yesterday that this new variant is believed to be up to 70% more transmissible. How confident are you in that 70% number?
So we have done work with our modelling experts at Imperial to compare this variant to the other variants that are circulating and look at how we think this is transmitting and causing increased numbers of cases. The figure of 70% it looks like a good one, but we don't have very good confidence intervals around that. So the confidence intervals are very wide at the moment. We're doing further work looking at the difference with the sort of S gene dropout, which we discovered last weekend, was a marker for this variant. And that will give us an increased amounts of cases that we can track and follow and give us better estimates over the coming week. So we hope to refine those estimates, though I think 70% looks like a good number to land on at the moment. As we refine those, we will, of course, tell you and the public.
OK, thank you for that. Really good to know a bit more detail about that figure. We spoke to Debbie Schroeder just before the interview with you, who was saying that it's really too early to know whether or not the new virus could cause increased mortality or whether it may react to the vaccine in a different way. Is that right? Is it too early to know?
So, of course, we don't have the laboratory experiments for the vaccine yet, but the vaccine should induce a broad immune response. And therefore, the mutations that we see on the spike protein in this particular variant don't suggest that that vaccine will not respond yet. And that, of course, is done with hypothetical studies with protein experts who reconstruct what this part of the virus looks like with these mutations. What we are clear about is that we have further laboratory work to do. We're growing the virus at the moment in Colindale and Portendown and Imperial. And with the virus grown, we'll be able to look at how the virus is killed by both people who've had the infection before and also people who've had the vaccine. And those will give us definitive answers. But those are lengthy studies that will take a couple of more weeks before we're able to definitively say the response.
And how about the potential of increased mortality? We were told yesterday there's no evidence to suggest that people are more likely to get sick or more likely to die if they get this particular variant. But of course, we know there's a lag between people catching the virus and getting ill, going to hospital and sadly dying. So is it too early to know that?
So I think we've got no signals. So the first signals we would expect to see is in the southeast, where this has definitely increased over 4 weeks now. So we're seeing the increases there. I think it is too early to say in London because those increases have only happened in the last couple of weeks. But what we know is that the more cases that we have in the community of this virus, the more cases we're seeing in hospital. But we're not seeing a disproportionate number of people being admitted to hospital over the last 2 weeks. And we're not seeing any increases in mortality yet. We do have further studies underway where we're studying this variant versus other variants and trying to link that with hospital data so we get better estimates. And we're also looking at further studies to try and understand that in the laboratory. But again, these things will continue to emerge over the coming weeks.
Really interesting. Thank you so much for talking us through all the research you're doing. It's certainly what I and lots of our viewers are fascinated by and really interested in this morning, so thank you.